Understanding fertility and infertility. Definitions. Fertility versus infertility. Fertility and infertility are terms that are commonly used in reproductive medicine. While they are often discussed together, they refer to opposite concepts. Here's a breakdown of each term. 1. Fertility. Fertility refers to the natural capability to produce offspring. It is a biological function that allows individuals or couples to conceive a child. Fertility depends on multiple factors, including the health of the reproductive system, the presence of viable eggs and sperm, and the ability to achieve successful conception and carry a pregnancy to term. Key factors influencing fertility: ovulation and sperm production. Healthy ovaries that release eggs and healthy sperm are essential for conception. Reproductive health. The overall health of the reproductive organs, uterus, fallopian tubes, testes, ovaries, plays a crucial role. Age. Fertility tends to decline with age, especially after the age of 35 for women. Male fertility can also decrease with age, though more gradually. Hormonal balance. Proper hormonal function regulates ovulation in women and sperm production in men. General health, nutrition, physical activity, and the absence of chronic illnesses like diabetes or thyroid disorders contribute to reproductive health. Fertility in women. In women, fertility is typically assessed by regular menstrual cycles, ovulation, and the health of the reproductive organs. The most fertile years for women are generally between the ages of 20 and 35. After age 35, fertility begins to decline significantly. Fertility in men. Male fertility is primarily dependent on the quantity and quality of sperm, which is measured through a semen analysis. Men's fertility is also affected by age, with sperm quality often declining after the age of 40. Fertility testing. For women, hormonal tests, such as those measuring follicle-stimulating hormone or FSH, ultrasound imaging, and tracking ovulation through basal body temperature or ovulation predictor kits. For men, semen analysis to assess sperm count, motility, and morphology. 2. Infertility. Infertility is defined as the inability of a couple to conceive after 1 year of regular, unprotected intercourse. It can be caused by a variety of factors related to both male and female reproductive health. Types of infertility. Primary infertility. This refers to couples who have never been able to conceive after a year of trying. Secondary infertility. This occurs when a couple is unable to conceive after having had at least one successful pregnancy. Common causes of infertility: female infertility, ovulatory disorders. Irregular or absent ovulation is one of the most common causes of female infertility. Conditions like polycystic ovary syndrome, PCOS, can disrupt normal ovulation. Fallopian tube blockage. Blocked or damaged fallopian tubes prevent the egg and sperm from meeting. Endometriosis. Tissue similar to the uterine lining grows outside the uterus, often blocking the fallopian tubes or impairing egg release. Age. Women's fertility declines with age, particularly after the age of 35, due to fewer eggs and diminished egg quality. Uterine abnormalities. issues such as fibroids, polyps, or other structural problems with the uterus can prevent implantation of a fertilized egg. Male infertility, low sperm count, oligospermia. A low sperm count reduces the chances of fertilization. Poor sperm motility, astenosospermia. If sperm cannot swim properly, it may not reach the egg. Abnormal sperm morphology. If the sperm is malformed, it may not be able to fertilize the egg. Varicocele, a swelling of the veins in the scrotum that can interfere with sperm production. Ejaculatory dysfunction. Issues such as erectile dysfunction or retrograde ejaculation can prevent sperm from being ejaculated. Infertility testing. For women, testing might include ovulation tests, hormone assessments, hysterosalpingography, HSG to check fallopian tube patency, and ultrasound to assess the uterus and ovaries. For men, a semen analysis is conducted to evaluate sperm count, motility, and morphology. Treatment options for infertility. Ovulation. Induction, medications like Clomid or injectable gonadotropins are used to stimulate ovulation in women who do not ovulate regularly. Intrauterine insemination, IUI. Sperm is directly inserted into the uterus to improve the chances of fertilization. In vitro fertilization, IVF. Eggs are retrieved, fertilized outside the body, and then implanted into the uterus. Intracytoplasmic sperm injection, and its ICSI. A single sperm is injected directly into an egg, usually for male infertility. Surgical interventions. Surgery may be required to correct anatomical issues such as blocked fallopian tubes or varicoceles in men. 3. Fertility versus infertility. Key differences. Fertility is the natural ability to conceive and carry a pregnancy, while infertility is the inability to do so after a year of trying without contraception. Fertility depends on healthy reproductive systems in both men and women, while infertility is often caused by an issue within the reproductive system that hinders conception. Age. Fertility decreases with age, especially in women, while infertility often becomes more common as people age. Treatment. While fertility issues can be managed through lifestyle changes, medical treatment, or assisted reproductive technologies, infertility usually requires medical intervention, such as medications, surgical procedures, or ART. Conclusion. Fertility and infertility are key components of reproductive health. Understanding fertility helps in managing reproductive choices, while infertility requires careful diagnosis and medical intervention. Couples who face infertility can find hope through advanced medical treatments, from medications to assisted reproductive technologies, ART allowing many to achieve their dream of becoming parents.